We are so fortunate to have the opportunity to speak to Dr. Jason Rivers, one of the most prominent dermatologists in North America, and is the past president of the Canadian Dermatology Association. Dr. Rivers is an extremely prolific researcher, having published more than 170 articles and book chapters, and is a principal investigator for over 70 different clinical trials in the field of dermatology and aesthetic medicine. Welcome to Singapore, Dr. Rivers.
Thank you, Sylvia.
Thank you. And first of all, what do you like most about Singapore from what you've seen in the past few days?
Well, this is my first time, and I really can't say there's one thing I like. If you said, what are the top three things,
Okay.
I'd say the people, very
Nice.
warm and
Yeah.
endearing. The food is great,
Yeah.
and I love the architecture here.
Oh, okay, that's wonderful. Singapore.
If
would
you
be-
said my least favorite, it's that I don't have enough time here.
That's well, you just have to come back.
I'd
Yeah.
love to.
The first technical question is, I know you're about to present on one of the most important studies in the field of aesthetics, the Harmony study. Could you give our listeners an idea of what this is about in a very broad sense?
Well, this was a study that looked at the effects of a multimodal treatment plan to improve facial appearance on the psychological benefit and really holistic impact of this type of treatment on how people felt about themselves and how they were observed by others.
Yes. And that, I think, is very important for the field of aesthetics. We always say that, as opposed to other fields of medicine where you have numbers or very concrete endpoints, for aesthetics, where our goal is perhaps beauty or increase in self-satisfaction, it's very difficult to quantify that. Which brings me to my next question. What are the key findings of the Harmony study?
Well, the key findings are really multiple, but what they indicate is that actually doing a multimodal approach, meaning not just treating with one type of drug or device, makes the face much more harmonious. But not only does it do that, it helps to reduce a person's appearance of age. They look younger.
Mm-hmm.
It improves their self-esteem. But more interestingly, I think the study showed that when we look at not only how the patient felt about things, what the observer felt about the person who had the treatment. Meaning that if you were at a party and you saw somebody for the first time, how would you react to that person? And this study showed that, in fact, the person would be considered more attractive, more intelligent, more approachable,
Yeah.
more educated, and had a higher income.
That
So
is
it's-
very powerful.
Yeah.
And the multimodal approach includes, could you just describe the treatment combinations?
I can.
Yes.
The multimodal approach includes using botulinum toxin, hyaluronic acid gel fillers. In the American study, using a topical eyelash enhancing agent, which is not available here in Singapore or Malaysia. And in a Canadian study, which was a spin-off of that, we also did skincare and as well what's called ATX 101, which is in North America an agent to reduce submental fat.
Yeah, that is very interesting. And if you could just describe to our listeners the average age of reduction in terms of self-perception, self-perception age reduction with the multimodal approach.
Well, in the American Harmony study, it was as much as 6 years.
That's incredible.
In the
Yeah.
Canadian study, we found it was about 3.5 years.
That's still very powerful.
It's not bad.
Yeah, that is really good. And finally, I'm going to switch to a different topic, which is the fact that you are the past president of the Acne and Rosacea Society of Canada.
Mhm.
Could you comment a bit on, and these are two fairly common conditions here in Singapore, could you comment a bit on the role of botulinum toxin injected intradermally for the management of rosacea?
Well, this is a relatively new concept. It's been in the literature for at least 5 or 6 years now. And the concept is to use a very low amount of botulinum toxin to help reduce flushing and redness in individuals who have rosacea, and may have a positive effect in acne as well. Using different dilutions but essentially delivering about 10 units per cheek.
Yeah.
To have an effect. And how does this work? It's not totally known, but it's thought that this may reduce substance P and other vasoactive agents. There may be a direct effect on mast cells as well. So all these together help to reduce redness and subsequent flushing that you see in association with rosacea.
Yeah, that's really great. So many other applications of botulinum toxin that we're still discovering off-label.
Correct.
Yeah. I hope that we have a chance to work together with future studies. I'm sure Asia Pacific would be so fortunate to have your expertise.
I'd be happy to come back.
Thank you so much.
My pleasure.